Hello, I'm Dr. William Inman. This, in fact, is a miniature lecture on one of the more common metabolic disease conditions that we see in veterinary medicine. Feline lower urinary tract disease, FLUTD, or Feline Urolithiasis Syndrome, as it used to be called 1,000 years ago, is a recurrent infection occurring in the bladder of the feline due to the fact that the body is concentrating urine to such a high degree that the actual inorganic solutes of the urine actually precipitate because it is so concentrated in the urine, and that plugs up the cat. In a boy cat, it can plug them up and be life-threatening and have to be removed or the animal will die. In the feline female, essentially, they can end up passing these stones continually, essentially, but have low-grade bladder infections continually, and they can be septic or non-septic, essentially. We used to change the diets, and that would help them, and certainly does. However, the underlying problem for even the animals whose diet has changed and the pH has changed and all that has changed, the underlying problem is that the urine is entirely too concentrated. Cats are desert creatures, able to concentrate urine up to a huge level, like a camel, essentially, and they're also nocturnal by nature. We try to get them to eat normal food and be up during the day. It's basically kind of messing them up. However, the problem exists whenever we see this condition is an animal that has incredibly concentrated urine. So all we have to do is just get the cat to drink more water, which, by the way, is impossible. So what we can do, however, is we can dilute the urine or make the urine more normal, essentially, because normal cats don't have this problem, by basically addressing that which is compromising the urine concentration in the first place. And that, of course, is only one thing, and that is blood that goes through the kidney. 40% of the cardiac output goes through the kidney of the kitty cat. Should produce urine in around a specific gravity very similar to the human being, or a little bit more concentrated. But when it's much higher than that, it'll precipitate these solutes and deliver the disease condition called feline lower urinary tract disease, or feline urolithiasis syndrome, FUS or FLUTD. The interesting thing is what we found automatically when we started adjusting these cats for one reason or another, back pain usually, we found that when we came down their backs, their FLUTD and FUS went away, and we couldn't quite understand what that was until we finally realized over a period of time we were actually resetting the actual neurological interferences that were occurring in the paraspinal area. We were actually taking elevated sympathetic tonus and dropping it back to normal, allowing the parasympathetic tonus to come back to normal. And when it did, then we had increased amount of blood supply through the kidney, and the urine specific gravity would drop down towards normal. So no matter what we use for antibiotic therapy or diet change, we could, with this approach, actually get the animals resolved. As we show you in Module 4, essentially in the actual certification process, we show you the technique that we can actually adjust the autonomic nervous system. It isn't any more complicated than that. And that along with whatever conventional approach we use to treat these conditions, makes our success for the acute exacerbation of that problem more successful, and also the animals don't come back and recur. Also, we can in fact utilize frequencies using frequency-specific low-level phaser in a couple of different ways. First of all, we can treat the kidneys of the cat. We can treat the kidneys of the cat with a laser. The frequencies for the kidney is 43, 24, 784, and 230. But we can also treat the kitty cat's sympathetic nervous system with the frequency is 216, 153, 36, and 42, essentially. These frequencies are used essentially to reboot, if you will, the sympathetic nervous system and reboot the parasympathetic system, which is a slave to that. So when we're treating FUS and FLUTD, we basically will treat them if they're infectious with antibiotic therapy, dietary change, or whatever, but we always add this because we really only need to treat them once. Essentially, once we get this other problem under control, they become like every other cat, and the urine specific gravity drops down to normal. How do we know that? Well, we can take our refractometer and we can actually determine what the specific gravity of the urine is. If it in fact is below 1030, we won, essentially. However, these animals that have FLUTD and also FUS, they have specific gravities well over 1060. And so that, in fact, is the underlying problem. More blood through the kidney means the animal doesn't have this disease process. You can see more about this technique and methodology. This we call Somato-Visceral Therapy, and you can see this on the website vomtech.com, where you can actually investigate these approaches, and we'll show you actually how to do this for free. I'm Dr. Inman. Thank you for looking at this particular condition. I cannot underestimate how many animals, kitty cats essentially, are fraught with this type of problems that go either undiagnosed or treated incorrectly. Thank you very much and have a great day.